And action.
In this video, we're going to go through the systemic circulation associated with the kidney. Now, if you are starting to look at the kidney, you're already getting the idea that there's some special processing that needs to happen with the blood here, because the kidney is going to interact with the blood to remove components from the filtrate and allow us to take unneeded substances or excess materials and put it into the urine, and then return the remaining needed substances to the blood. So we're going to be, since this is a systemic circulation, we're going to be starting with the left ventricle. And obviously there's aspects that aren't visible here. So from the left ventricle, blood would go into the ascending aorta, aortic arch, thoracic aorta, and then we're seeing the abdominal aorta here. Okay, so you can see that, and this is the anterior surface of the abdominal aorta facing you, because you can see those three vessels associated with the splanchnic circulation, and the two red vessels that you see here going into each kidney are the renal arteries. Okay, now once the renal artery enters the kidney, it is going to divide into branches. The first set of branches are referred to as the segmental arteries. And then those are going to divide into interlobar arteries. Okay, and this is going to allow the blood to get to the juncture between the cortex of the kidney, where most of the urine production occurs, and the medulla of the kidney, where the urine is collected and directed toward the various tube-like structures that are ultimately going to carry the urine away from the kidney. Okay, so the name of the artery that is here at this kind of border between the cortex and the medulla would be the arcuate artery. And it's referred to as arcuate because it kind of arches over segments of the medulla called pyramids. Okay, and then we can also see that there are branches of arterial branches heading out into the cortex. Those are referred to as the cortical radiate arteries.
Okay.
Okay, so let's look at the circulation inside the kidney in a little more detail, specifically the circulation within the cortex associated with the functional units of the kidney, the nephrons. Okay, so I've drawn in an arcuate artery here. So from the perspective of this illustration, what would be below this artery on the board would be in the medulla, and then what's above is the cortex. Okay, so we're going to have our cortical radiate artery. And we're again using red as our international color for oxygen-rich blood. And the cortical radiate artery is named because it appears to be radiating out into the cortex. Okay? Now we're getting close to a capillary bed. So we know from studies we've done in the past that the type of vessel that directs blood into a capillary bed is an arteriole. Okay, so what's branching off of this cortical radiate artery is an arteriole, and it's specifically referred to as the afferent arteriole. Okay, so you should already be thinking that something might be up, because when you have something afferent, you usually have something efferent as well. Okay, so this is kind of a signal to us that something funky is going to be happening here. Okay, and I'm going to make this longer than it really should be just because I need the room for the words. But this afferent arteriole is directing blood into a capillary bed. And this capillary bed is kind of a mass of capillaries. It's referred to as the glomerulus. Okay, now this set of capillaries is specialized for filtration. So we're going to say that this produces the filtrate. Okay, so all the way through this capillary bed, the hydrostatic pressure is greater than the opposing pressure, and so we're going to produce filtrate all the way through, have capillary filtration occur all the way through. Okay, and we're not drawing this capillary bed in the usual way that we do of the color changing to purple, because gas exchange doesn't happen in this capillary bed. The sole purpose of this capillary bed is to allow filtration to occur. Okay? So we can think of this, like when we talked about capillaries in the past, we talked about that color change, and we also indicating that we were kind of allowing exchanges to occur of oxygen and carbon dioxide and nutrients and waste. That really isn't happening here. And we also talked about how as you went through the capillary bed, the hydrostatic pressure would decrease and the osmotic pressure would become greater. That is never going to happen in this capillary bed either. The hydrostatic pressure is always going to be greater than the osmotic pressure. So we can almost think of this capillary as the arterial end of a capillary bed, because it's always going to be filtering. Okay? And we're going to keep it red, and then we're going to have a second arteriole which is the efferent arteriole. And this is going to direct blood into a second capillary bed, which I'm indicating as purple, and these are the peritubular capillaries. Okay, and I've kind of drawn them in a non-specific way here, but we'll look more at what their structure is and how they're related to the nephron in another video. Okay, so, and I just realized I spelled arteriole wrong. Let me fix that before we go on. Arteriole. Okay, so at this place, the purple is representing that exchanges are happening. Okay, and we also have a situation where hydrostatic pressure drops below osmotic pressure here. So we will have reabsorption happening and material moving into these capillaries. So the glomerulus is essentially the arterial end of the capillary as far as we're concerned. The peritubular capillaries would be the venous end of the capillaries, okay? And these are what are going to eventually lead into the cortical radiate vein. Okay, so we have this really interesting kind of middle section of the circulation that allows us to filter the plasma and then gives us a mechanism to reclaim material from that filtrate that we need. From the cortical radiate vein, we're going to have a series of veins that is ultimately going to direct blood back to the renal vein. The renal vein is going to attach to the inferior vena cava. and the inferior vena cava is connected to the right atrium, and that completes our circulation.